Good eye movement there with no nystagmus. And then we would do a cover-uncover test. So I want you to cover your one eye. I want you to look that way and turn loose. So stay looking that way. Okay, and then we would do it the other eye, other direction. Look that way, uncover. All right, and her eyes both go in the same direction there while covered. So no issues there. 1, 2, 5 and 7, 3, 4 and 6. 8 is hearing, so we're going to get to that. So we go ahead and check our hearing. I'm going to have you, well, let's look in the ears first. So, coming over here. Her ears, both symmetrical, tragus intact, flexible cartilage, no scarring of the cartilage. Lobes are pierced, they're equal round, and the top of the ear there equal with her canthus when we look from the side. Letting my patient know I'm going to be looking in her ear here. Visualizing the tympanic membrane. Here on the right side, our light cone. Looking, I see some terminal hairs, a small amount of cerumen. The tympanic membrane, an opaque gray, it's not bulging, not reddened. The other big thing I note is I can see where the malleus is touching up against the membrane here. Here again, some terminal hairs, small amount of cerumen. Visualizing the tympanic membrane there again, also opaque gray. Light cone is at 7 o'clock. 5 o'clock on the other side, I can see where the malleus is up against the tympanic membrane there. Then we're going to start with some sounds here. I'm going to have her plug off this ear. I'm going to whisper something on this side.
Going Captain.
Okay. And plug off the other ear. And it's sprinkled today.
It's sprinkled today.
So she heard both things that I said. We're going to check with some sound vibration. Tell me if you hear this in one ear or both ears.
Both ears.
Both ears. And then we're going to compare direct contact versus the actual air vibration. So air vibration should be 2 times as long as direct contact. So right up against the mastoid process here. Can you hear that?
Yes.
Tell me when you can't.
Can't hear it.
Okay. Can you hear it now?
Yes.
Okay. And tell me when you can't hear it anymore.
Can't hear it.
Okay. Timing it there as I was checking. Over here again. Tell me when you can't hear that anymore. Can you hear it?
Nope.
Okay. Did you hear it at all?
Yes.
Or that's when it went out. Okay. Let's do that again. Okay. Can you hear that now?
Yes.
Okay. Tell me when you can't hear it anymore.
Can't hear it anymore.
Okay. Can you hear it now?
Yes.
Okay. Tell me when you can't hear it anymore.
Can't hear it anymore.
So their direct contact the actual air vibration 2 times that of direct contact. I need to look into your eyeballs real quick. Don't let me forget. So cranial nerve 8 there real quick. And let me take a peek into your eyeballs. I got a little bit ahead of myself. So, darkened room, light reflex. We're going to come in, we're going to start at the nasal side. We're going to visualize the vasculature there in the back, looking for areas of crossing over, anything going on. And then we're going to work out here more laterally. We're going to visualize the optic disc in the fovea centralis. Both here, foveus centralis a little bit yellowed, optic disc a little bit grayed. Good connection there. Let our patient recoup there for a minute. Not seeing any lesions, not seeing any odd changes in the blood vessels, either shrinking or overlapping of the vasculature. Over here, same thing. Come in on the nasal side first, medial. Get a good view, and then we're going to swing over and look more laterally. Here again, vasculature is well defined. Not seeing any crossing over of the vessels. Both the macula and the optic disc well defined. No lesions in the eyes. Eyes, got that. Got the ears. So now we can move on to our facial. We did our facial gymnastics. So now cervical, I'm going to palpate her lymph nodes. We got the postauricular, the occipital, preauricular, glossopharyngeal. We got the sublingual, submental. We got the anterior chain of the cervical chain. We got the posterior cervical chain. So go ahead and palpate her neck here. Not feeling any step-offs, deformities, or crepitus. The cervical vertebrae are well defined. Any pain when I palpated your neck?
No.
Any pain with neck movements?
No.
Okay. So have you just bring your neck over here, over here. I'm not going to test strength of it right now because I'm going to do that a little bit later. We're going to go ahead, take a quick peek in her mouth here. Okay, got a quick count of teeth. We got 28 teeth. Of course, I would ask if she should have her wisdom teeth in by now. There's no wisdom teeth, so I'm guessing you had them pulled, correct?
Yes.
Okay. Quick peek at her gums. They are pinked. They're well attached to the teeth. She does have a few fillings here, not seeing any cavities. Lift your tongue for me. Her frenulum is still attached there. I can see the Wharton's ducts and the other two saliva ducts over here to the side. Not feeling any stones. Good vasculature. Nice pink color. The lower frenulum is still intact, as is her upper gums, well attached. No areas of redness, no bleeding, no pus. Looking good there. We would go ahead and have her look. Stick her tongue out. Give me a big ah. Okay. Not seeing any tonsils there. Tonsillectomy. I already know that one with her. Anterior pillars are there, and I see her uvula move up and down. We would check a gag reflex, and we got the tongue movement side to side. So cranial nerves 9, 10, and 12. On cranial nerve 11, going to have her shrug her shoulders. Again, strength there. Good strength. Cranial nerve 11 is intact.